1 in 8 women will get breast cancer at some point in her life. Our friends at the Sentara Comprehensive Breast Center are there, though, for every step. I recently sat down with Dr. Geoffrey Moorer, hematology and oncology expert inside Sentara's Cancer Network Resource Center. So we started off by just talking about the importance of getting that annual screening for mammograms.
Well, mammograms save lives. We know that early detection of most cancers, including breast cancer, leads to a higher rate of cure. So the goal of a mammogram is to diagnose cancer before it's advanced, before it causes symptoms. When you catch it early, you have a higher chance of curing it. A mammogram is a great screening test because it's cheap, it's effective, it's readily available, and it's also safe. So it's very important to get that annual mammogram for most average at-risk women.
Well, another important topic that we covered was COVID-19. We know that so many women put off their annual mammogram. So I asked Dr. Moore about the impact of the pandemic.
Well, we know with the pandemic in early 2019 that a lot of facilities stopped doing screening tests for obvious reasons. They were focusing their resources on treating patients who had become infected with COVID-19, but also trying to mitigate or prevent the spread of the pandemic. So we know that for instance, in April 2020, the rates of mammography dropped to about 1% as they did compared to 2019. But once we started to develop strategies to mitigate the spread of COVID-19, and we came up with strategies including things like masking, PPE, and obviously the vaccines, screening mammography rates have rebounded, and they're now about 90 to 95% of what they were. So for any woman who has missed their mammogram because of the pandemic in 2019 or 2020, we certainly encourage them to get back on the wagon per se and start getting their annual mammograms again.
And as you just heard, it's so important not to delay your mammogram. I also asked Dr. Moore to talk a little bit about the imaging center and other resources available there in Prince William County.
No, I'd be glad to. I can't emphasize enough how important the imaging center is for patients in actually the community, the Prince William County and surrounding community. What it means is that women will have access to state-of-the-art breast cancer imaging services, including mammography, including MRI, including breast ultrasounds. But the big thing is that it's close to home. They don't have to leave their community to get state-of-the-art advanced breast imaging. So that's huge. We can't emphasize that enough.
And also seeing just some friendly, smiley faces to make the whole thing just feel a little bit easier.
Absolutely. Close to home in your own community. You don't have to drive 50, 60 miles in order to get good breast imaging. So it's huge.
Well, Dr. Geoffrey Moorer, thank you so much in Woodbridge, Virginia at the Sentara Cancer Network Resource Center. Thank you.
Thank you very much for having me.
So it's important to know your risk and get your annual screening for your mammogram starting at age 40. Make sure that you schedule your Sentara mammogram now by calling 703-523-1560, or you can just visit their website at sentara.com/mammogram.